Bismillah wa salatu wa salam ala Rasulillah. Here is Ali Al-Jamri. Today I'm going to finish the course for Pharmacological Management of Pediatric Dental Patients. And if you remember, in the last lecture, we spoke about dental sedation. And we discussed all kinds of sedations in terms of routes, consideration, and we discussed in details the nitrous oxide sedation and how we can do it in the clinic, right? So these are the outlines for the whole course. The only thing that we're going to do today is we're going to speak about general anesthesia in terms of definition, indications, and contraindications. And I think we met all the above learning objectives. And today we're going to do the one related to general anesthesia. So let's start our journey. So general anesthesia, the definition of it is a medically controlled state of unconsciousness in which patients are not aroused even by painful stimulus accompanied by loss of protective reflexes. So the key points here, or the main difference between general anesthesia and sedation, that even with painful stimuli, you cannot awake the patient, and the patient will not respond to you. And the other important thing, that the airways or the patient cannot maintain by himself or herself a patent airway, and you need to have a positive pressure ventilation because there is a depressed spontaneous ventilation. So as we mentioned in the sedation, that these are the main differences, and this is one of the most important points that should be very clear for you, that in the sedation, the patient will respond to you, even if not with a minimum stimuli or tactile, light stimuli, with painful stimuli. At the end, the patient will respond. But for the general anesthesia, it's not going to happen. And the other main difference is the patient maintaining a patent airway. So for the general anesthesia, you should protect the airway because there is no reflex, okay? What are the objectives of putting a child into a GA? We want to eliminate cognitive, sensory, and skeletal motor activity in order to facilitate the delivery of comprehensive dental care. And one of the key points here is comprehensive dental treatment, because usually what will make us go for GA and not sedation if we need a comprehensive dental treatment. GA is a valuable treatment modality that allows the dentist to provide quality dental care to child patients who are unable to be treated using psychological method or physical restraint or sedation. So this is also very important, that we should know that the general anesthesia is our last resource. It should never be used routinely for the convenience of the dental team, because sometimes for the dentist, although the general anesthesia is very demanding and it's very difficult to do, but usually they will prefer it if the child, like for example, uncooperative, and the dentist doesn't have time in the clinic to do child management and to do tell, show, and do, and to take it step by step. Some of the dentists will just prefer to take the child to general anesthesia, but this is not the case. We should try all the non-pharmacological child management, and then we should try to see if the child is suitable for sedation. If not, then we go to general anesthesia. Dental treatment of a child under general anesthesia effectively treat the dental problem, but they doesn't address the primary symptom of the child dental fear, because now the child will be sleeping for the whole procedure. And then when he awake, he will find all the teeth are fixed, right? So the child didn't cope with his fear or anxiety. And if this child needs another dental treatment, most probably you have to send him again for treatment under general anesthesia. And this is one of the main disadvantages of the general anesthesia, that you are not treating the child anxiety and fear. It's not like the tell, show, and do and all the non-pharmacological child management technique, or not like the nitrous oxide. Because in other technique, the child will remember that he coped with the treatment and it was painless and everything went fine. Here in the general anesthesia, they will not remember anything. So that's why usually children who treated under general anesthesia at the beginning, they will need, if the treatment failed or if the parent didn't follow the instruction of oral hygiene or anything, they will need a retreatment under general anesthesia. So what we usually recommend to avoid that after the general anesthesia, the child behavior should be managed by preventive appointment subsequent to general anesthesia. So after doing the general anesthesia, usually we tell the parents to bring the child after 2 weeks. And in this appointment, we check for the treatment we did under general anesthesia, and we do a fluoride varnish, or we do, for example, oral hygiene instructions, and or we ask them to bring the toothbrush with them and we brush the teeth, or we do polishing, any like preventive measures or small simple procedure to gain the child cooperation. And then we take it from there. We tell them, bring him again after 3 months or after 6 months, and we start to keep on following up with preventive appointments. So the main advantage of the general anesthesia, the general anesthesia is efficient and convenient method of treating pediatric patients who cannot be treated on the dental chair. It doesn't cause emotional trauma for the patient because they will be just sleeping all the time. It's require no cooperation from the child and allow for extensive dental treatment to be provided in a single visit. These are the main strength point of the general anesthesia. But what are the disadvantages? Complications are more likely with GA compared with conscious sedation, both during and after the procedure. So you need a well-trained team to do the general anesthesia. The general anesthesia depresses the cardiovascular and respiratory system. Laboratory tests are often required before having a GA, and usually this is a big problem because, why I put it as disadvantage, because some of the children, they have a great phobia from not only dentists, but from the whole environment of the hospital. So when you ask them to go to the lab to take a blood sample, it's a big deal for them. They will not tolerate the injection to take the blood sample. And I remember I have more than 3 operations that they were canceled because the children, they did not cooperate at the lab. They failed by any means to pursue them to take a blood sample. And then at the end, we have to cancel the GA because the anesthesiologist refused to get the child into the operation room without knowing without doing a CBC for the child. So it's one of the disadvantages. If the child has a phobia from the needle specifically, the laboratory test will going to be a big problem. For some group of medically compromised patients, it's contraindicated for elective procedure. So sometimes we used to have a very complicated cases in terms of medical problem. And usually when we refer the child for his doctor for clearance, the doctor refused to give the clearance. He said, no, if this is elective, the child is not in severe pain, we prefer to give the child, for example, only analgesic for the dental pain. I will not give clearance at this stage for general anesthesia. Some of them may be in a sickle crisis, for example. So the doctors refuse to give clearance for elective procedure. If it's emergency, then the doctors and the anesthesiologist should look at the risk versus benefit ratio, and they should come up with a decision in this issue. Also, the operator can get very tired very quickly when doing the session. And honestly speaking, the general anesthesia is very demanding. So this because you are not treating the child in the dental chair. Usually you will have the operation, it's like a couch, and the position will be very difficult, and you will be treating a comprehensive and complete oral rehabilitation. For example, you're going to do like 6 pulp therapy, and you're going to do 4 crowns and 3 class 2, and you're going to do strip crowns in the anterior. It's very demanding. The one operation may take about, it depends, of course, on the operation, but it's going to sometimes take up to 2 hours, for example. And in the list of the operation, you will have 4 up to 5 patients per day. So it's very difficult to do. It's not, some of the people think it's easier for the operator to do it, but it's not. The dental chair is more comfortable as a position for the operator. And it needs, one of the disadvantages also, that it needs very advanced training for the anesthesia team. You need, of course, anesthesia team, you need special equipment, and you need facilities. So it's usually, you have to do it in a hospital-based setting. There is a lot of dental clinics that they can do it in a clinic-based operation, or they call it one-day operation, but they should have the special equipment, and they should have a recovery room, and they should have an ICU in the clinic, in the dental clinic. So at the end, even if you are not doing a hospital, and you should only treat patients with the SAA 1 and 2. So even if the child, if you have all your equipment, but the child is a complicated case, you have to go in a hospital base. You don't do it in your normal or routine dental clinic. One of the disadvantages also, the patient cannot drink or eat for at least 6 hours before the procedure. And you will not believe how difficult it is to convince a child not to drink water 1 hour before the operation. Usually they will wake up, they are fasting, and they will come to the operation, especially the last patient on the list. So you will have your first patient, second patient, third patient. By the time of finishing your third patient, the fourth patient will be crying outside because he wants to drink water, or he wants to drink milk, or anything else. But you remember that we speak about the fasting rules and everything, but at least for the general anesthesia, they prefer 6 hours fasting, okay? And the last disadvantage, that it is expensive. It's very expensive in comparison to doing the treatment in the chair with no pharmacological technique or with sedation. The general anesthesia is way more expensive. So what are the indications? For the indication, we divided it into 3 indications or 3 categories. The first category, patient with general medical problem. The second one, patient with extensive dental needs. And the third one are patients who do not cooperate. And let's look in details for each one. Patient with general medical problem, because it's risky to treat them in a usual way on the dental chair with local anesthesia. For example, a patient with, let's say, seizure, they have epilepsy. So it's maybe difficult to treat them in the chair. Patient with sensory or mental problem. Patient with physical disability, uncontrollable motor deficiency. So if they have uncontrollable movement, it's very difficult to treat them in the dental chair, even with sedation. When local anesthesia is not effective, for example, you have severe infection, or there is an allergy from any of the components of the local anesthesia. So you have to go for general anesthesia. And when there is uncontrollable epileptic crisis, as we mentioned. Patient with extensive dental need, when it is impossible to treat them in the clinic, and as we mentioned, if they need a comprehensive oral rehabilitation, or they have to be treated in a single visit. For example, cardiac patient, when you're gonna give prophylaxis antibiotic, it's better to go for a general anesthesia and to do everything if they need extensive treatment, other than dividing the treatment into appointment in every 2 or 3 weeks when you have to give prophylaxis antibiotic. Or sometimes in hemophilic patient, when they need a factor replacement, it's also better to go for general anesthesia and to do it in a single visit, other than giving prophylaxis or to factor replacement in each visit. Also, in cases of extensive orofacial trauma or fracture, it's better to go for general anesthesia. With serious craniofacial anomalies, usually we go for general anesthesia, and multiple extraction. Because with multiple extraction, usually it's very difficult to give bilateral block, for example, or to give multiple visits, or sometimes even if you're going to do it under sedation, controlling the bleeding will be difficult. So it's better to go for general anesthesia. And the third one is patients who do not cooperate for the reason of fear and phobia. They cannot even tolerate sedation. And usually this will be like a severe phobia. They refuse everything related to dental treatment. So it's better just to put them to sleep and to do everything. Inability to cooperate due to immaturity. Sometimes they are very young. You remember in the ECC course that usually they are like 2 years old and they have a severe ECC, and you need to do a full mouth rehabilitation with bulk therapy and crowns. So they cannot cooperate. You have to go to general anesthesia. Or if they reject violently the treatment, and usually this happened to us with teenagers. if they have fear and anxiety or phobia, and they are around 12 or 13 years, usually they will reject the treatment violently. So at these cases, it's very even risky to do a sedation because they can go to violence. It's better to go for general anesthesia. But also in cases of if they have severe autism or psychosis, because as we mentioned, in sedation, sometimes there is a hallucination. So if the child has a psychosis, it's better to go for general anesthesia or any other uncontrollable behavior. So in these cases, and usually, as we mentioned in the sedation, it's going to be a case-by-case decision. So you sit with the child, you sit with the parent, you discuss all the factors, and then you decide it's better to go for sedation or general anesthesia. What are the contraindications of general anesthesia? If there is a great risk from the general anesthesia itself, and in these cases, it's not going to be your call as a dentist. It's going to be the anesthesiologist call. Usually when we refer the child to anesthesiologist before the operation, usually they refuse to give, they said, it's not refusing, they said the child is not suitable for general anesthesia at the moment. For example, if there is a respiratory infection or if there is a high temperature, active systemic disease, in these cases, especially if it is an elective procedure, it's considered as a contraindicated for dental general anesthesia. And then, okay, so everything is sorted out and you put your patient into general anesthesia. Why you gonna monitor? You have to monitor the vital signs during and after the treatment to ensure safety and well-being. You should look at the whole vital signs. And it's not, in the general anesthesia, to be honest, it's not your responsibility as an operator because you're gonna be focusing inside the patient mouth and you are looking at putting the Pharmacological, stopping the bleeding or measuring the sizes and doing all the stuff. It's going to be the job of the anesthesiologist, okay, or the anesthesia technician. They have to monitor the vital sign. But even it's not your primary role inside the general anesthesia or inside the operation, but you should be aware. If you hear the sound, the alarming sound, if even you feel that the patient start moving, sometimes we feel it by the tongue. So you are working, you feel that there is a small movement of the patient tongue against your finger. Or you feel you are not working against a dead weight. So usually in the operation, we feel that we are working against a dead weight because the child is completely asleep. When you start to feel a resistance, that means there is something wrong happening. So you should tell your anesthesia specialist that there is something happening here, okay? So that's why you should be monitoring. And if there is anything happen, you should report it immediately. And even after the operation, you should write it down in your files. You should write what happened. The anesthesiologist will write it down, and you also should write that any side effects or any problem that happened during the operation. And then after you finish the operation, you have to move, not you, but with your team, all of you move the patient to the recovery area. At the recovery area, you will meet the parents and you should sit with them and you should give them instructions. You should give it verbally and written instructions. Verbally, because you should make sure that they understand everything. And written, because usually at that point, they will be a little bit confused and distressed because their child just came out of the general anesthesia. And when they go home, they will have questions. So that's why you should give them in written. In this instruction, you should tell them what to expect during and after the recovery. So usually we tell the parent that the child now, when he wakes up, he will be very agitated, he will cry, there may be some bleeding. I should tell them all that he may complain of some sort of pain. I should tell everything. And what they should do after the recovery. When we're gonna discharge them. So you're gonna stay with us here, for example, for 3 hours. Usually with the dental general anesthesia, if the child is healthy, usually they stay after the operation for 3 to 4 hours only at the hospital, and then we discharge them. So I have to tell them that, don't worry, you're gonna stay here for 3 to 4 hours. We want to monitor the patient. And because usually the patient has been fasting for 6 hours before the operation, so I'll make sure that he's awake and he can eat something. And then I should tell them what he should eat. At the hospital, they will give them the meal, right? But when they go home, I should tell them, for example, for the first day, avoid any hot food, try to have soft, cold. I should give them some examples. Avoid doing this, avoid, for example, going to sport, avoid any physical activity. And I should tell them what medication, if there is any medication, for example, if the child needs antibiotics or analgesic, and how to use it. And I should give them all the information, verbal and in written. And usually I should be very specific on when can the child resume normal activities, because they will ask you, can the child go to the school tomorrow? And it depends on the procedure you have performed. So if I did 16 extraction, I'm not expecting the child to go to school, right? So I should also discuss this with them. And the last thing, I should tell them what to do if there is any problem. Should tell them that, for example, the dental clinic will be closed, but the emergency department is open. So if there is a bleeding, if there's severe pain, if the child starts to vomit, if the child, for example, go into sleep for unusual interval, I will give them all the worrying signs that they should come back, when they should come back to the emergency department, okay? And lastly, we should know that if any emergency occurs, either before the general anesthesia during induction, or inside the operation, or outside, or even in the recovery, the staff, this is not only for the general anesthesia, it is for the general anesthesia and for the sedation. The staff should have a clear plan for responding to emergency. In this plan, usually we know each one of us what's going to do. Who's going to bring the emergency drugs? Who is going to start the CPR? Who is going to do this? Who is going to do this? Everything should be stated clearly. All necessary drugs and resuscitative measures should be available at the operation, either if you are doing sedation or if you are doing general anesthesia. All your emergency kits should be available. All staff should be trained in basic life support. And if you can have a pediatric basic life support, it's going to be better, but at least you should have your BLS. And this training should be updated on a regular basis. And this will depend on the area that you are practicing. Some countries require the BLS to be renewed in every 2 years, but that depends. But at least you should make sure that you have an updated license of the BLS. Okay? And that's all for the general anesthesia for today. I hope it's simple and clear for you. And I'm just going to give you a quick conclusion that you should know that pharmacological child management technique can be an effective way to manage the behavior of pediatric patients who are fearful or anxious about dental treatment. Sedation is minimally invasive procedure usually that can help to calm and relax the child during dental treatment. And there is several different types of dental sedation, including nitrous oxide, oral sedation, and intravenous. On the other hand, general anesthesia is more invasive procedure that renders the child completely unconscious during dental treatment. And it's typically only used in cases where dental sedation is not sufficient to manage the child's behavior or the dental needs. And the decision whether to use pharmacological child management technique should be made case-by-case basis. As we said, there is no recipe book that we can use for all patients. We have to do it case-by-case, and we should take into account the child age, the medical history, and the level of anxiety. And it's important to discuss the risk and benefit of these techniques with the child parent or guardians before making a decision. So the decision should be informed decision and should be combined between the operator and the parents. Thank you. I hope you get the maximum benefit from this lecture. And if you have any inquiry or question, we're going to meet in the live session, inshallah. And here are the reference and the reading recommendation. I would recommend reading from Wilbury or reading from the AAPD guidelines. Thank you very much.